Hi, Dr. Tony. Thank you so much for coming on the Art of Living Well podcast. We're really excited and honored to have you here today. Marnie and I both met you in the fall. We were at Dr. Stephen Cabral's Reimagining Health Summit conference, and we heard you speak, and we just knew immediately that we wanted you to come on our show to share all that you're doing in the cancer prevention space and curing people and your very innovative and holistic approach to cancer. And, we know that this is going to resonate with a lot of our listeners out there, unfortunately, given the prevalence of cancer these days. And we're just really excited for you to be here. So thank you.
Thank you for this opportunity. It is true that education and information couldn't come at a better time now. As we're upon 2025, we know that it's so highly needed because in my world, in the cancer world, and also in the wellness world, we need to not be statistics, right? With respect to cancer, we now know that the incidence of cancer is increasing, especially in the younger population. Cancer that we've never seen at 25 years of age, breast cancers, colon tumors. And then the patients that were in remission, they're coming into an area now where they're having recurrences and relapses more than ever before, and more aggressive cancers. I've been doing integrative oncology for over 30 years, and these are different times. So these types of podcasts are so vitally necessary and important. So I encourage everyone listening and viewing that it is now time to be proactive and start today, not mañana, as we say in Mexico, right? Today.
You're absolutely right.
Thank you very much for that. And we want to dive into all of this. But before we do, we would love to learn just a little bit about your journey in a nutshell and how you came to specialize in integrative cancer care and open up your centers, Hope for Cancer. Can you share with our listeners just a little bit about your path?
Yes, thank you for that. We often think that we have the plan established in our life and our journey. At least we do in our own minds, right? And then we have a higher power that kind of dictates what happens. And so that was precisely what happened to me. Since I was a little boy, I knew that I wanted to become a physician. That was deeply rooted in my thought process. And I was in the surgery path. And my father was diagnosed with prostate cancer. He lived in Houston, Texas. At that time, he went to a conventional hospital in Houston that we all know, very famous one for cancer. And unbeknownst to me that this was going on, he didn't tell me until he had a treatment there and he felt very ill. He said, and then that's when he called me. He said, son, I can't do this anymore. I said, do what? So then he explained to me he was diagnosed with prostate cancer and he said, help me. And that shifted my life into helping my dad with stage 3 prostate cancer. And he was in his early 60s. So thankfully, he survives. He was cured under my care, and he lived to be 83 years of age and ultimately passed away from congestive heart failure. And even that, the cardiologist said that he had like little time to live, and he far outlived his prognosis by the cardiologist as well. So that's one thing. And maybe a more powerful story is when I had a prophecy in a church in Houston, and that's a long story, so I'll be brief, and that it was prophesied over me that I would have a healing center, not in this country, meaning in the US, where many will come to find health and healing, and that I would travel the world, I would treat famous people, generals, governors, royal families, and so forth. And I must say that has been confirmed, that has happened. I've been blessed to travel to over 70 countries. Actually, I just got back from Dubai a couple nights ago, now in January 2025, when we're doing this podcast, and treating, some very important family in the Middle East. So God has been good to me. He has steered me on this journey, and it is a mission. It is my passion. And fortunately, my family understands me with this and supports me on this mission and passion. So it's quite a blessing.
Well, thank you for sharing all that. So let's dive in. I know you started talking a little bit about this, but cancer is very prevalent today. You mentioned that kids are getting cancer, young adults are getting different types of cancer that we typically haven't seen before. Can we just share, with our listeners, can you share what causes cancer? How does it start? How does it grow? Can you ever maybe we just start there.
Okay, yes, because that's a loaded question in itself. But,
right.
So I've seen throughout the years that patients with a cancer diagnosis come to Hope for Cancer and they don't know the answers to these questions. They didn't ask the oncologist, what is cancer? Has anyone seen a cancer cell metastasize? For example, if it started in the breast, how does it get and survive in the liver and survive in the bones or the lungs? What is this? So cancer cancer cell starts off as a normal cell. That cell gets damaged by, you name it, mental toxicities, heavy metals, negative thoughts, poor diet, lack of exercise. Maybe one can say that these viruses that are going around now can contribute to this as well, to the formation of abnormal cells. And so that abnormal cell or damaged cell has three possibilities. One is to repair itself. If it doesn't repair itself, the second option is to kill itself. And that happens every single moment in our lives. Damaged cells apoptose. That's called programmed cell death. You know that a white blood cells, or for example, a red blood cell lives 120 days. And so these cells are being turned over every day. Liver cells live approximately 500 days. White blood cells live minutes or sometimes hours. So there's a constant turnover. And so if a cell cannot kill itself or apoptose, then it's going to go rogue. And as any living organism, it's going to try to survive. So a cancer cell is a cell that was damaged due to one or multiple factors, like I mentioned, toxicities of many kind, poor nutrition, lack of exercise, environmental factors. It didn't kill itself or apoptose, and now it goes rogue, and that is a malignant cancer cell that will try to survive. And it's not there to kill the person. I learned this actually from a patient of ours who said, Dr. Tony, she speaks to her cancer cells or to the cancer cells, and she says, hey, I can't go because if I go, you go, meaning the cancer cells need a host. So the purpose of a cancer cell is not to kill the host, the person, because then it has no place to survive. And so that's a deeper message in why this cancer developed. And oftentimes, Stephanie and Marnie and listeners, patients tell me this is the best thing that happened to me. And it's like kind of you scratch your head. How can cancer be the best thing that happened to you? Right? But it was definitely a wake-up call. And so this has taught them to smell the roses, if you will, right? And correct the things. So cancer is an expression. It's an opportunistic disease, something that favored its development, its growth, and its progression. And so this is why we at Hope for Cancer, myself, I coined the 7 key principles to cancer therapy, because this is also focusing on the whys, right? The lack of oxygen, the toxicity, the poor immune system, the emotional, mental, spiritual factors, the nutritional deficiencies, and so forth, the lack of a ideal or optimal microbiome. So that's the subject of my first book.
So as you're seeing patients coming into your clinics, are you seeing trends in the type of cancers that people have, or trends in the things in their life that you mentioned, like maybe not working out or having a lot of mental
Mhm.
stress or being exposed to heavy metals? Are you seeing certain trends?
Yes.
And, who are these people coming in for treatment?
Yeah, number one is we're seeing cancer numbers of types of cancers that we have not seen so many of in past years. And by past years, I mean 5, 6, 7, 10 years ago. The first one that comes to mind, Marnie, is pancreatic cancer. There seems to be an epidemic of pancreatic cancer. We're seeing a lot of it, more breast cancer than any ever before. 40% of our patients at Hope for Cancer treatment centers are breast cancer patients.
Wow.
And if we take into consideration the significance of the side of the breast cancer, the right side versus the left breast, they have a different emotional, biological meaning. And I'll say it briefly. The right side is the male side. So everyone with right breast cancer has a male dominant, deep trauma, whether it was a sexual abuse, it was something there deep from the male perspective. The left side is more the mother, the nest, the niche. And so there is where we look at issues with respect to mother-child, the person as a child to their mother or as a mother to their child. So there definitely is a correlation with where the cancer presented, whether it's breast or pancreatic or colon, and traumas, biological traumas that are associated with them. We're seeing more lymphomas than before. So pancreatic, lymphoma, breast, and I would say the next one will be colon cancer. A lot more colon cancer than before. And of course, that's related to nutritional factors, right? And lack thereof in optimal, non GMO, organic, healthy nutrition. And to answer the second part of your question, some of the things or trends that we're seeing is a lot of heavy metal toxicities. And if we look at the world in general, specifically in the US, the three main toxicities nowadays are aluminum, glyphosate, and mercury. And so heavy metal toxicity is rampant. We check every patient's heavy metals, and there is no one that, including myself, that I tested myself, there's no one, or even patients that come to our wellness program that are apparently healthy. We have not found anyone that does not have heavy metal toxicity to some degree or another. So that's a big one. The other one that we are seeing is very low vitamin D levels. And we know that vitamin D has hundreds of important functions in our body, from immune modulation or an optimal immune system to decreasing inflammation and so forth. So we recommend the blood serum levels of vitamin D to be 80 or above. And the average in our patient population is 35. And
Wow.
conventional doctors are saying, that's fine. You're fine at 35, right? Or at 40. No, no, no. So that's a big one. Heavy metals, vitamin D. Think of this. Cancer has four main characteristics. Number one is inflammation. And inflammation is a driver of disease, and not only cancer, but a lot of autoimmune disease and cognitive decline and many other pathologies. So, inflammation. Secondly, is acidity. Cancer and disease thrive in an acidic medium. So, what are we doing to decrease acidity? How is our sleep? How is, again, our water intake? How is our nutrition? How is exercise? You know, so many of these factors that decrease acidity and inflammation. Number three, characteristic of cancer will be low oxygen. Cancer thrives in a low oxygen environment. So nowadays, people are more sedentary than ever before. I just came from Dubai, and you don't even walk there. Everything is by car. I was helping someone at a hospital there in Dubai, and my hotel was across the street. And I told the family members I could walk across, and they said, no, we'll send a driver to pick you up. And I'm like, what? And so exercise, and now with the younger population, right? I mean, I don't see kids with broken arms anymore, or as many as I saw when I was a kid. You know, a lot of us had casts on our arms at some time during our life. When do you see that nowadays? It's very rare to see a child with a cast on, right?
I guess kids aren't climbing trees like they used to, right? Yeah.
Right. Yes. And so the fourth one is low temperature, hypothermia. It's another factor that is a characteristic or hallmark in cancer and disease. We need to heat up our bodies. We need to sweat. We need to detox. This is why I love near-infrared saunas. I love infrared lamps, right, that are so powerful and give you that infrared energy that is very physiological to our body. So when we do near infrared light specifically, our cells are like, that's in the 660, 680 nanometer spectrum, which is the spectrum that our cells physiologically and naturally are attuned to. So, yeah, those are some of the trends that we're seeing now.
And it's so scary. And Marnie and I both see it, sadly, all too often. And which is why we wanted to have you on, because so much of what you're sharing today is not just for cancer patients, but for everyone to be doing preventatively. So everyone out there listening, it doesn't matter if you have never had cancer, right? Like, listen to all of this. And there's so many good suggestions that you've already even peppered in, just even with your vitamin D levels should be. And maybe this is a good time to dive in. And you mentioned your 7 key principles of cancer therapy, which is in your book. And it's all about your centers that you have, the 2 centers you have in Mexico. Can you dive in and go through each of those?
And actually, before you dive in, can I just ask you one question? When we're talking about the type of person that comes to your center, would you say that these 7 key principles that you're going to talk about right now are relevant to anyone with any type of cancer, or is it more specific to someone maybe in like the stage 1, stage 2 range, or, you know, a breast cancer versus like a pancreatic cancer that's very far along? Can you just clarify that before we talk about the details?
Yes, they're very relevant to everyone, independent of the stage of the cancer, independent of the type of the cancer, independent of the location of the cancer.
Okay.
And in addition to that, they're very relevant, as Stephanie mentioned, to all of us for wellness, for prevention. So even though I call them the 7 key principles to cancer therapy, I'm thinking maybe, for example, the first one is non-toxic cancer therapies. So for a while, I thought, why should I, Tony, do this one of the 7 key principles? I don't have cancer. Why should I do a non-toxic cancer therapy? And then I saw the light. And it was because we are all forming cancer cells every moment of every day. It's estimated about 150 cancer cells are forming in our body every day. So we need to be proactive in eliminating these cells. And if we are overweight, we're obese, we're not sleeping enough, and so forth, then they can take root and eventually lead to a diagnosis of cancer. So we should all follow the non-toxic cancer therapies, even if it's a wellness program patient. And the reason, Marley and Stephanie and the viewers, is because now in oncology, we know 14 biological characteristics of cancer. That means all cancers have these 14 characteristics, no matter the type or the location. And this is peer-reviewed, published information. The work was done at Harvard, at Stanford, at Boston College. So this is not like Dr. Tony saying this at Hope for Cancer. This is known information, but conventional oncologists don't look into this because chemotherapy or radiation or surgery or immunotherapy are not addressing these characteristics of cancer. And we could talk more about that. But I named 4 characteristics already: low temperature, inflammation, acidity, and low oxygen. And there's 10 others. How cancer cells are able to suppress the immune cells, for example, or allow the immune cells not to see the cancer cells and mount a specific attack. How cancer cells are able to suppress some genes like the P53 gene, which is the guardian of the genome. And cancer cells, it's a smart disease. It's not a stupid disease. Cancer cells are very smart. It's methodical, and they know how to suppress many things in our body to further their growth. So all that being said, the 7 key principles are in one way or in multiple ways addressing and focusing on the 14 biological hallmarks of cancer. And I mentioned the first key principle, which is non-toxic cancer therapies. And those are things like sonodynamic therapy, using sound therapy to affect cancer cells. And I've been doing this since 2002. And guess what, everyone? In October 2023, the FDA in the United States approved sound therapy or sound waves to target liver cancer. And as I said, we've been doing, and this work was done close to you, where you are, in a different state, but in the University of Michigan is where these studies were done.
Go Blue!
Yeah, well, go Wolverines. and the FDA just approved that in October 2023. And using sound to attack cancer cells. Well, we're using sound therapy since 2002, not only for liver cancer, but for cancers in other places like the breast, like the lungs, like the prostate, like the colon. So that's one. Photodynamic therapy, using light to target cancer cells, is very powerful. This year, I'll be going to an international conference called IPA, International Photodynamic Association Conference. They meet every 2 years. The last meeting was in 2023 in Finland, and I participated in that. It's research scientists and a few doctors from all over the world, the best of the best places: Cleveland Clinic, Mayo Clinic, Sloan Kettering, Austria, Germany, all over the world. And this year it will be in China that we meet to explore that. And again, using light is so powerful to target cancer cells. And then hyperthermia, heat therapies. And, I could go on, but this is a big focus of using non-toxic cancer therapy. And I must say, at times, we must avail to an integrative approach. We must avail to giving a patient, for example, radiation. We just had recently a patient with breast cancer with metastasis to the lower back. The pain was excruciating. If we put her on morphine, that can help the pain, of course, but it's addictive, it's constipating, it depresses the immune system, all these morphines and opiates, narcotics, and it doesn't do anything but potentially further the growth of cancer because of its immunodepressant effect, the numbing effect, and so forth. So we gave her what we call spot radiation to that L1, L2 lower lumbar area, and her pain went away 95%. She's not in pain. She doesn't need opiates or narcotics. Every once in a while, a lesser pain medicine will do.
So to interrupt you for a minute, you were able to do that as part of your protocol?
Yes, at both of our treatment centers in Cancun and in Tijuana, we have all the tools we need. We have radiation therapy when needed. We have surgeons when we need to do a surgery, whether it's a lumpectomy or a mastectomy. We also do low-dose chemotherapy, which is different than the conventional chemotherapy. It's called IPT, insulin potentiation therapy. Always, though, in the context of an integrative approach. And this is the beauty of what we do when we have to add those conventional therapies, is also following the 7 key principles of cancer therapy.
And that's what I really appreciate about your approach. It's not just, kind of one way or not, whether it's traditional or more holistic, and you're treating the whole person, not just the cancer, where it is in the body, whether it's breast cancer or colon cancer, wherever. So I think that is just wonderful. And you're setting people up, and you can continue to go through these principles, but you're really setting people up to make lifestyle changes after the fact so that they can go on and live a really healthy, long life, which is the goal, obviously.
Yes, that's very important, because it's not only longevity and extending their life and getting to a place of, I'll use that bad word, cure, because most oncologists don't like to use cure. Yes, you could be cured, right? You could be cured. Yes, why not? So that's important, and quality of life, right? Because even if you or I want to live, or will live another 10 days or 100 years, we want to live with the best quality of life. And by the way, we have data on that. We have a research and education team at Hope for Cancer, headed by a smart Indian scientist, double PhD. So we have quality of life data. We have 5-year survival data for 7 types of cancer. We have longitudinal studies. So we have studies on vitamin D levels, on inflammatory markers, many things. So yes, that's very important what you mentioned.
So will you keep talking about those principles for us?
Yes. And the second one is the immunomodulation. We know that the immune system protects us from a cold to cancer and everything in between. So upregulating the immune system is crucially important to have an optimal immune system. And we know patients, if they have fear, if they have had chemo and other toxic therapies, the immune system is depressed, and negative thoughts. Maybe they see themselves in a coffin because the oncologist gave them a prognosis. That in itself suppresses the immune system. So optimizing the immune system and the immune system's ability to see the cancer cells is very important as well. So that's principle number 2. Number 3 will be full spectrum nutrition. By that, I have coined a term in my first book called the Garden Food Plan. In my 30 plus years of experience in integrative oncology, I have concluded that the closer we are to the garden, the closer we are to natural, non-GMO, and we all know this, foods is better, and food or nutrition. I don't like to say diet because, I got to follow a diet, right?
Yeah, no.
So,
we don't either.
like diets, right? So, nutrition is very individualized and very personalized. A typical Hope for Cancer nutrition plan is not for everyone. So we have nutritionists at both of our treatment centers in Tijuana and Cancun that assess the patient carefully and very deeply. As I said initially, we have test equipment from Europe that's approved medical devices in those countries, where we look at very fundamental issues or challenges with nutrition and gut health and so forth. So, but mainly it's getting closer to the garden as possible. So that's the third key principle. The fourth one is detox. And for this, I start off with saying a negative thought can kill you faster than a bad germ. So we have to detox what's up here.
So true.
Yes.
So true. Yes. And as you were saying before, I think it was you, Stephanie, about treating the person holistically. Another quote that I've been said to have mentioned some time ago is, you treat the person with the cancer, not the cancer in the person, right? So that's the approach. And the same thing with viral infections or anything. It's not about treating the COVID in the person, it's the person with the COVID. So detox is important from the emotional, mental, spiritual perspective down to the skin, the gut, all the organs of elimination is important.
And you're catching us right now while we're running our group winter detox program. So we're both in the heart of detoxing ourselves.
Yes, we're in the middle of our liver detox, which is, Dr. Cabral talked about it at the conference probably.
Yes.
When you were there.
And yes, and one of my favorites is coffee enemas. And I start
Oh, I knew you were gonna say that.
We haven't added that in yet, but
No.
that might be for one of our future ones.
Yeah.
Okay. Well, you may have a challenge with coffee enemas. That is that you will get addicted to them and you will love them because they're fantastic.
They scare me.
I mean, if I say a year from now or however long that I'm addicted to coffee enemas, Marnie, you just, I mean, I don't know, maybe.
I think, Dr. Tony, you need to challenge us to try it in 25 because I find it a little frightening.
I am very frightened by it.
Let's do it. And we call it Star Butts. And no.
Oh my God.
Wait, you call it what?
Star Butts.
Oh.
And no coffee or cream,
funny.
of course, right?
No cream or sugar.
Right. Yeah, that's what I meant. No cream or sugar. Yes. And it has to be the right coffee with a high amount of palmitic acid, because palmitic acid is what starts to purge the liver and the gallbladder, right? So, but I do 5 a week. And as I mentioned, I was just in Dubai for an extended period of time. And I made a mistake. I didn't take my travel kit with me. And I just couldn't wait to get back home and do my coffee enemas. So awesome.
Okay. Can I just ask, what is so addicting about them? Like, how do you feel? You feel amazing, but what do you notice versus all the other modalities that you're doing?
You have to do it to answer your own question. But what do I feel? What do patients tell me?
Yeah.
Cognitive improvement. It's like your mind is clearer. You get a balanced sense of energy. And it's not like the jittery type energy, it's balanced. And then you feel like your abdomen, your gut is like, it feels so clean, so nice. And guess what? By doing a coffee enema, you're increasing the glutathione production of your liver, which is a major antioxidant, as we know, by 200 times.
Wow.
So
wow.
It's very powerful. We have these tough, rough guys from Texas or Wyoming or Montana. The cowboys said, "Oh, nothing is going down in that direction." By the end of the first week, I kid you not, they say, "Can we have 2 a day?"
Oh my gosh. Okay, that's it, Marnie.
I actually would love for you to come back on and just do an episode, even if it's like a little short one on that topic, because I feel like we could talk an entire time just about that and how.
Okay, we'll do that, but after you and I do 1 month.
Yeah.
Okay.
And remind me,
putting a challenge out there, people.
Let's do it. And remind me, both of you, when we do that, I want to tell you a story of an oncological surgeon that brought his wife to us, who's his anesthesiologist, and she was diagnosed with cancer. So I'll tell you that story in that episode.
Okay.
Mm-hmm. The next key principle is oxygenation. And as I mentioned, that's one of the 4 characteristics of cancer is low oxygenation. And I think that nowadays people just don't oxygenate enough. When you take a deep breath, it kind of feels uncomfortable, right? And oxygenation doesn't cost anything. Breathing techniques, walking, grounding yourself, eating live, healthy food, as you know from the works of in the integrative health practitioners, Dr. Cabral and all of you. Nutrition is key. So let's eat live green food. Food that is alive will increase our oxygen storage. And then, of course, if you want to get to another level, like we do in our treatment centers, we're talking about ozone therapy, ozone rectally, drinking ozonated water. We're talking about hyperbaric oxygen chambers. We're talking about inhaling hydrogen and oxygen gas, right? Which there's a lot to be said about hydrogen, molecular hydrogen and its benefits in health. There's other techniques where we can increase oxygenation at a clinical level. And then the 6th key principle is restoring the microbiome. And we always think of the microbiome as what, ladies? The gut, right?
Yep.
But there's many microbiomes.
Right?
Yeah, it's all over. And the one I encourage everyone to not forget and pay special attention to is the microbiome of the oral buccal cavity, the mouth, because you cannot have a healthy body if you have a mouth that is toxic and with a not optimal microbiome. And for this, we need to look at 4 dental toxicities. One is cavitations, where a tooth was extracted, the gum sealed or healed, but it left a pocket underneath the gum. And that pocket is called a cavitation. And this is a fertile environment for toxins and bacteria. And be it, you might not have pain because the body is kind of sequestering that in that area, right? So, but cavitations are notoriously unhealthy and notoriously infected. So that's cavitations. The other one is, of course, metal fillings, amalgams, and most of them are composites, not only mercury, as people say, oh, mercury filling. Yeah, but there's other things in that filling. There could be tin, there could be other metals in there as well. So those have to be removed by a holistic or biological dentist, very carefully and well done under the right protocols and so forth. And then number 3 is gingivitis or periodontal disease, gum disease. It is estimated that 75% of the population in the US has some degree of gum disease. And this is a must to be cared for. And the 4th toxicity in the mouth is root canals. And I want to say this very clearly. There's never, ever, never, ever. Did I say never, ever? Yes. There's never, ever, never, ever a healthy root canal tooth. And I don't care what your dentist tells you. Oh, that's fine. The panel x-rays doesn't show anything. The x-ray is fine. You need to do a 3D CT cone beam scan, and it has to be read by a person that is well trained in reading this, because if you don't do a 3D CT cone beam scan, you might miss up to 70-75% of dental issues or challenges, including root canal disease. So unfortunately, if you have a root canal, remember that's all teeth are associated with an organ, right? And so those teeth have to be extracted. There's no if, ands, or but about that. And so a root canal tooth cannot be saved. It's a dead tooth. Dentists are the only ones that leave something dead in your body.
Can I ask you a question going back to the cavities and the metal fillings? So I have a couple metal fillings from like when I was like 6 or 7 years old. They've been in my mouth for so many years at this point. Do you think they're still potentially causing harm in my body?
So I just want to clarify, Marnie, you said cavities. It's cavitations. Okay, cavitations. Oh. Yeah, cavitations where a tooth was extracted, the gum sealed, and it left a cavitation, a pocket under the gum. Okay. We didn't mention cavities, right? It's cavitation. Okay.
So a cavitation is different than a cavity? Is that what you're saying?
Yes. Yeah, cavity is an infection in your tooth.
Yeah. Cavity. Okay. I misunderstood you.
Yeah.
But I do have some old cavities from when I was a little kid, and I have like 2 little silver thingies in my mouth still.
Yeah. So with regard to the silver, that these are called metal fillings or amalgams.
Yeah.
If you had them when you were 6 or 7, they're still potentially emitting vapors of mercury. The University of Calgary in Canada, of course, did studies with a special imaging electron microscopy, where they saw that these metal fillings, you call them silver, that's a common thing that people call them, silver filling, metal fillings, amalgams. They can be 20, 25. You look like you're 18, so maybe, that was...
I'm 51, so they're pretty old.
Yeah, so...
They're like 40 years old.
They're still emitting vapors of those toxins. especially when you're drinking hot fluids, right? So they need to be removed properly. There's a whole technique. It's called the Huggins technique. Dr. Huggins, Huggins, developed this technique where they put a rubber dam. They do a special suctioning device. There's a lot of water being used. It's a special technique to take away these silver fillings, as you mentioned. And then you replace them with that white filling. It's called a resin. And those are non-toxic and beautiful. They even look better. And so that's what you need to do, Marnie. Go to a biological dentist, not a regular dentist.
Okay. Thank you.
So I want to give everyone a couple more tips with respect to oral dental health. You need to rinse, you need to water pick, you need to floss, and you need to brush at least 2-3 times a day. And you need to use different toothpaste. I'm a toothpaste fanatic. So I have 5 or 6 or 7 different toothpastes without fluoride, of course, that are non-toxic. So you alternate. Like in the morning, I brush with one toothpaste, in the afternoon or after a meal with a different one, and at night with a different one. What is happening is that you're creating a more favorable microbiome in the mouth. If you use the same toothpaste over and over again, it can disrupt or affect your oral microbiome. So use different toothpaste throughout the day, and floss, water pick, and rinse. I want to give all your listeners, viewers, a quick recipe on making your own mouthwash, because those that are sold commercially are no bueno, not good.
Mm-hmm.
And so let's make our own. Get a glass mason jar and put in 500 milliliters of distilled water. And the mason jars have like the markings, right? So you put 500 milliliters of distilled water. Then you put 2 teaspoons of baking soda. That, of course, is healthy, no aluminum, all that. And then you put half a cup of xylitol. And xylitol is with an X, right? Xylitol, which is a sugar. And the reason for using xylitol is that any pathogen bacteria in your mouth will suck in, absorb the xylitol, but guess what? It cannot break it down. So the bacteria die from toxicity to the specific type of sugar, that it's a natural sugar, by the way. So no problem if you have cancer or anything like that. And then at the end of that, you put in essential oils. Yeah. Any one you like, peppermint, cinnamon, orange, a combination of one. If you use essential oils like from Young Living, they have one called Thieves. If you use doTERRA, they have another one that has a combination of different oils. So just be creative, and that should last you about 2 weeks. And then the next batch, put different oils. Thyme. You could put peppermint.
Okay, thank you so much for sharing this, because I struggle with that. Like, I want to use a mouthwash, but I know I shouldn't. And my dentist, who's a holistic dentist, has some. Then they're like so expensive. I'm just like, what do I do? This is so easy and almost free. So,
and my whole family, like my kids, my husband, they all use the commercial mouthwashes, and I'm constantly telling them that they're not good. And so I'm going to do this. I'm going to make this.
I'm like really excited about this, actually.
Me too.
I have everything I need, right?
And I'm also curious, what are the toothpaste brands that you like that you mentioned? Just, can you name a couple?
Yes. Essence. I mean, I could run to the bathroom and pick them, but Hello, I like the Hello brand.
Oh, my kids use that. They like that. Yeah. Okay.
Essence, there's a number of them.
So like the commercial ones that are non-toxic.
Oh, yeah.
We'll link a few of them up.
Yeah, we'll link some up. I love wellness.
I have one. I'm blanking on the one I use, and I love it.
Yeah. And, some have charcoal. You could do that. Tea tree, some with tea tree oil, aloe vera, different things that you find in these different toothpastes are excellent.
Well, so I just thinking about oral health and some of the things that you've said, I every so often we'll come across a person that has just rancid smelling breath. And I
Mhm.
always wonder if it's what they're putting in their bodies and their oral hygiene, and maybe it's coffee. Like, I don't know, but do you have any thoughts on that?
Yes, that's what you said, Marnie. It could be something local, but we have to look more deeper. Like you mentioned, you gals are doing a liver detox. So check the
Mm-hmm.
liver, detox the liver and the gallbladder, and go systemically with that, as well as locally with the indications, the recommendations I just gave.
Okay.
Yeah.
Thank you. Okay. I know
And
you.
so we have one more of the 7 key
Yes.
principles to wrap it up, and that might be the most important one. Although they're all key principles, it might be the most important one, and it is the one that when a patient is so compliant with everything, with detoxing, with oxygenation, with the immune system, with the microbiome, with the nutrition, and they say, but why is this cancer still not going away? And I could give you an example. We had a patient with a breast cancer, right side breast cancer. What was the right side? Male or female
Uh,
side?
Male.
Male, right? So
Male.
right
Yes.
side breast cancer, male side. And her name is Phyllis. And she was with me 2, 3, 4 years, and she was fine, working full time as a school teacher, but the tumor was still there. And, it was putting more gray hair on my head, like I needed more of it, right? And so, and so I started to learn this correlation with emotional traumas and cancer. And to cut a longer story shorter, it happened that she was sexually abused from the ages of about 10 to 11 or 12 years of age. And now she's in her early 60s. So she was sexually abused by her father, her grandfather, and her
Oh,
uncle.
so
Father,
awful.
grandfather, and uncle. So for 50 years, those three, I don't know what to call them, those three people knew that, and she knew that. And now I was the fifth person to know this. And so I help her let it go, forgive them, and let go of that trauma. A deep trauma that how could you ever forget that or it not affect you? Buried feelings never die. And this is a trauma that she had that was always affecting her. So I help her let go of this. I help her forgive those three guys. And guess what? In a very short amount of time, the tumor shoop, went away. I wouldn't have believed it if I didn't see it. And that's just one example of hundreds of examples that I could give you regarding emotional trauma and cancer, and also other diseases as well. So this might be the most important key principle of them all: emotional and spiritual healing.
And it's
And
probably the hardest to measure too. Like, it's the one
yes,
that,
yes, absolutely.
Western doctors poo
Mhm.
poo.
Right. Yes. And we know there's a lot of science behind this. And actually, that's a topic of my next book coming out later in 2025. It's called Emotions in Cancer. And
Oh,
so
Mm-hmm.
wow.
that's going to be, and that's why I picked that topic or that principle as my second book, because my goal is to write a separate book for each of those 7 key principles. The
Oh,
first
wow.
Amazing.
book, which is the seminal book, is called Hope for
Mm-hmm.
Cancer:
Second one.
7 Principles. Yeah, you got one.
Yeah. Yeah.
7 Principles to remove fear and empower your healing journey. And now I want to write a book on each of those 7 key principles. So the emotion one will be out in 2025. And then already kind of finished is my third one on nutrition, the full spectrum nutrition that I mentioned, because those are 2 topics that always are most sought after or people have more
Mm-hmm.
questions or challenges with, right? The
Yes.
nutrition and then the emotional component.
And they're very much related sometimes too. And
Yes,
so
yes.
does the emotion piece in like your new book, and I wanted to ask some questions on this, the best program you have, I think it's like the behavioral, emotional, spiritual therapy, is that's like all similar, right? From what
Yes,
you're saying, like the
yes,
healing. Because
yes.
I do wonder, if there's people out there that are doing a lot of the things already that you talk about with the 7 key principles, right? So they're eating a plant-based, non-GMO organic diet, and they're detoxing and they're taking the supplements and they're drinking clean water and all that. And they're still getting cancer.
Right.
So how, and obviously there's no prescriptive approach to this, right? There's things in the air and there's multiple factors. But are you seeing that the emotional component for people and unhealed, unresolved trauma is a big factor in diagnosis, the diagnosis that you're seeing and also the healing journey?
It's not big, Stephanie. It's huge.
Yeah.
It's huge. Yeah. And to the point that in both of our treatment centers in Cancun and Tijuana, we have 2 medical doctors in each center that all they do every day is work on that aspect of the patient's healing. And they're MDs trained in what we call the BEST program, behavioral, emotional, and spiritual transformation. And when the patients are discharged, we have 2 other practitioners that give them additional BEST sessions through Zoom, because we know the importance of this, and it's not done after 2 or 3 or 4 sessions. So we pay a lot of attention to that aspect of healing.
And so what are you seeing with I guess you gave that one example already.
Yes.
Yeah.
Yes. And there's many examples.
This could be like a whole nother, hour-long conversation, I'm sure.
I know we're running out of time, but I wanted to ask just like a few more tactical questions in terms of like, can a person come to your center if they don't have cancer? How long is a typical stay at your center? And
what does it look like? Like, what is their treatment plan look like? Yeah.
Okay. So we have 2 treatment centers, one in Tijuana, Mexico, across the border from San Diego, California. The other one is in Cancun, Mexico. The difference is that Tijuana is an inpatient. It's a small hospital. And those patients that go to Tijuana are more advanced with respect to the cancer. They might need 24/7 medical and nursing care. So those are the type of patients that go there. And the patients in Cancun are more stable. They're ambulatory, for example. We often have patients in wheelchairs that go to our Tijuana center. Treatments are the same. It's just the level of care that they need. In Cancun, those cancer patients stay in a hotel. We take care of all that for the patient. So it's they don't have to worry about where to stay. We help them with all that. And so that's the cancer part of it. The second, and they typically stay for 3 weeks initially, and then they go home with a 3 months home treatment, home program. And this is not just a bag of supplements. This is devices. Sometimes they continue injections under the skin, like with an insulin needle. We teach them how to do that. They continue coffee enemas. You'll be happy to know that at home. Some of them buy like ozone machines, so they continue rectal or vaginal ozone at home. So it's a very robust home program, right, that they continue on. And typically they return at 3 months' time for a follow-up visit where they get rescanned at home before they come back, or we rescan them in our centers. And then they could come back in 6 months or a year. So we just had a patient this week in our Cancun center. Anne is her first name. She's been with us 14 times. She first came to us 7 years ago, and she continues to come. She actually wrote a post in one of those social media things, and the post was quite nice because she said, "This is my 7 years," and just praising God and all that for her wellness and all that. I can't find it at the moment, but you get them every day, so many of them. So that's the cancer part of it. And we do have, Marnie, to your point, we do have a medical wellness program that we recently launched that's only in Cancun. And so far we've had patients from the Philippines. These are guys that are, and ladies that are in their early 70s maybe a little older, and they want to continue playing golf till they're like 120, right? So they came for the medical wellness program where we do an in-depth assessment, and then we tell them what areas we need to improve on. We offer stem cells. These are the best umbilical cord stem cells that I believe in the world. I've done a lot of work, stem cells all over the world, and it's fantastic. We've had patients from Japan, of course, from the U.S. So that's the medical wellness program that we have.
Sorry, just to clarify, that's if you don't have cancer and you're just
That's if you don't
more
have
longevity
cancer.
or just overall wellness.
Yeah.
Okay.
Wellness, prevention, longevity, assessment. It's all part of that.
So if you wanted to do that preventatively, how long would you come for?
We have a 1 week, we have like a 6-day program. We have a 2-week program and a 3-week program, depending on the health history of the individual. If you have diabetes, if you've had chronic diseases for a long time, then we prefer the longer stay. But most people come for the 6-day wellness program.
Well, if you ever need some guinea pigs, Stephanie and I could come down for 6 days and then do a whole assessment.
Yes. That actually sounds like wonderful.
Well, one thing you don't need is a beauty treatment because you're both like looking so good, right? And it's about that. It's about feeling well, feeling good, living longer, and looking good, right?
Yeah.
That's so important. Mm-hmm.
Absolutely. Well, this has been, I feel like we could go in 5 different directions. I think we'll just have to have you come back on to dive deeper into one of these topics. For someone out there who's listening, who's, this is new information for them. Maybe they have cancer, maybe they don't. But what suggestions or advice just to get started on this journey? Marnie and I talk about longevity all the time. A lot of our listeners really are starting to be more focused on longevity. They want to live to see their grandkids and play with them and just live a long, healthy life. What are 1 or 2 things that people can literally start doing immediately as soon as they're done listening to this podcast?
Well, she learned well very quickly.
She's a fast learner.
Well, the first thing I want to say is I want to congratulate you on this podcast, and it's called The Art of Living Well. What could be more needed now as we embark on 2025 and beyond than living well? So I love that. And to answer your question, you showed my book, and I have a copy of it also. Yes. And I would encourage everyone to get a copy and look at the 7 key principles and make an honest, real assessment of where you believe that you're at now within those 7 key principles. And every morning when you wake up, first of all, thank God, because as you know, 10,000 people don't wake up in the world every morning. With cancer, without cancer, apparently healthy, 10,000 people. So waking up is a good thing. So thank God for waking up. And then if there's someone next to you, your spouse, your dog, your cat, tell that being that you love them and, hug them or kiss them. And then think, what can I do better today than yesterday? Where can I step it up? And assess yourself. Well, my nutrition was not too good yesterday. I cheated. I had some ice cream, or I had that, pizza or hamburger or fries, whatever it is. And I want to improve on my nutrition today. Maybe today I'll do like a juice fast, right? To detoxify from what I consumed yesterday. Or, yesterday oxygenation wasn't the best because I didn't take my walk. It was raining and I didn't do the power plate or the trampoline or the treadmill in my house. So step it up. So the basic answer to your question, Stephanie, is think about the 7 key principles. These are things that you could do at home and step it up. Be very careful with how assessing yourself and being honest and changing the necessary lifestyle changes that you need to make, again, today, not mañana, as we say in Mexico, not tomorrow, today, because we need to for the reasons that we've discussed today. Its incidence of disease is only increasing. The quality of life is decreasing, unfortunately, in the world. And I really pray and hope that the new administration, independently of politics, right, that the new administration with RFK Jr. are really going to make those changes that America and the world needs, because we are examples to the world. And what happens at the NIH, National Institute of Health, the National Cancer Institute, also has a global impact. And so let's be examples to our children, our grandchildren, and our community. And it starts with one person at a time.
Yes.
Absolutely. Well, thank you so much. And your center is called Hope for Cancer, and we'll link up in the show notes exactly all the places people can find you and learn more about your centers. And as we wrap up this conversation, we love to ask everybody, what does the art of living well mean to you?
First of all, it means loving oneself. I think that self-love is something that is on the decline. And so we have to start with loving ourselves, right? And of course, that can segue into many other things. And secondly, is as a faithful person, is working on our spiritual life. Because now in the world, and for sure in the US, they're trying to take that spiritual aspect out of society, right? And so we need to get in tune with that, with our Creator. For me, it's God, right? We're a Christ-centered organization, but we have people from all denominations. We have patients from 70 countries. But whatever your spiritual self is, or your life, that needs to be worked on. And then being proactive, taking the steps now. And remember this, to wrap it up. It's never too late to have a happy childhood. So no matter what circumstances you had in your life, whether you were adopted, you were an unloved child, whatever, you had traumas. We all have traumas. We live in this fallen world. So we got to get rid of that stuff, got to get rid of that trauma. And it's never too late to have a happy childhood. And let's have joy, happiness. And I always say I want to end it with that, but I do want to end it with one more thing. I have twins that are 15 years of age now, boy and girl, Isaac and Isabella. When Isaac was 4 years of age, Isaac said something to me that I preach now all the time. And it just came to mind in your question is, Isaac said to me when he was 4, he said, "Dad, laugh more than laugh."
Oh, that's so
said,
cute.
Isaac, what does laugh more than laugh mean?
Yeah.
And he said, "Dad, people just don't laugh enough. We have to laugh more." And so, wow, what a lesson, right? From a 4-year-old.
Yeah.
Our kids are our biggest teachers.
That's right. Yes.
Wow. That's beautiful. I mean, the laugh more than laugh, he's so right. And the other thing that you said, like, it's never too late to have a happy childhood, that really is profound. I have never heard anyone say that before. So, and you're right. You're absolutely right.
Next time we'll expand on that a little bit more, Stephanie and Marty. Yes.
As we dig into the mental, right?
Yes.
Oh, yes.
And you're right. It's just not talked about when we we're talking more about mental health as a society. Yes, but not in relation to disease and cancer.
Right.
It's just not. So part 2 will be coming, guys.
Awesome.
Well, thank you so much, Dr. Tony. This has been, I mean, my mind is spinning.
I know.
Like literally spinning.
Yes.
So
yeah.
Thank you.
We can't wait to share this with everyone.
Yeah. And have a great day.
Yes.
Thank you.
Bye, Dr. Tony.
Bye.
Bye-bye.